The BC Chiefs of Police and the Canadian Association of Chiefs of Police both came out with policy statements supporting decriminalization, supporting a safer supply to replace the toxic drugs that you're talking about. Now, there's been a lot of media focus around diversion lately. The BC RCMP recently issued a statement saying that the presence of confirmed safer supply prescriptions are in the minority of drug seizures. Maybe you can tell me, is diversion of prescribed medications and drug seizures something new, something that started with the introduction of pharmaceutical alternatives? And also, from a policing perspective, what drugs are having the biggest impact in driving the toxic drug overdose crisis?
So diversion of prescription medication is nothing new. 25 years ago, when I walked the beat in the downtown east side, there was always somebody standing at Main and Hastings offering, T3s, for example. So the issue of diversion is not new. I think the devil's in the details when we're talking about diversion, because there's certainly diversion of prescription medication, which is different, but inclusive of diversion of safe supply medication. And then, of course, there is what is a much more pressing issue to me as a police leader, the matter of counterfeit pills that are produced and can be produced in very, very, very large quantities. And the problem with that is they look exactly like prescription pills. So the possibility of someone dying as a result of taking what they think is a diverted prescription are actually quite high, because we don't know what's actually contained in those counterfeit pills. And from an organized crime perspective, that can be really scaled up. Unlike diverted prescriptions or diverted safe supply, which is a very limited, more of a street level phenomenon, the issue of counterfeit prescription medication is capable of really scaling up, and that's a huge issue. So certainly that's one thing. And when it comes to what is the most deadly part of our drug supply, it's fentanyl, absolutely. In 85% of overdose deaths, it's attributable to fentanyl, and then cocaine, and then methadone. So what we don't see, at least not in Vancouver, and I can't speak for the whole province on this, despite the fact that I am here in my capacity as president of the British Columbia Association of Chiefs of Police. I don't know the nuances in all communities across the province, but in Vancouver, that's where our focus is, because that's what people are dying from, according to the coroner's data. They're not dying from diverted safe supply. They're not actually dying from diverted prescription medication. They're dying from fentanyl, coke, meth. And that's where we really focus our enforcement efforts.
And would you say that the deadly fentanyl is easier to access than the diverted hydromorphone on the street?
I would say it's more prolific. There's more of it. In British Columbia, we have somewhere between 4,500 and 5,000 people who are on a bona fide safe supply program. So it's a limited amount of drugs to be diverted. And the same goes with prescription medication. It's quite labor intensive.